The HyperCan study is an Italian multi-center observational prospective study enrolling subjects with just healthy subjects, they are healthy blood donors, and this is in the part of the project, and the other part of the project is patients with cancer, with different 4 types of cancer: lung, breast, gastrointestinal, and stomach. These patients may be in different stage of the disease, localized disease or metastatic disease. So the aim of the first study is to understand whether the hypercoagulable state as defined by markers of thrombosis marker, let's say, are predictive. High levels of these markers are predictive during the follow-up of 5 years of the diagnosis of cancer. So this is a sort of a prevention medicine for the early detection of cancer, using as a tool the coagulation markers. In the same study will be done prospectively on blood samples from the cancer patients, but in this case the outcome of the study will be the survival, the overall survival, the disease progression, and all the impacts that the hypercoagulation can have on the prognosis of cancer, response to therapy, and lots of other information about that. Because in the first study with the healthy subject, we will have 2 samples, one at the beginning when they are enrolled, and another after 6 to 12 months, because it's the persistence of the hypercoagulable state that probably may be more likely be predictive of this cancer diagnosis. Whereas in the patients that already have cancer, the blood sample drawing will occur on a different schedule, which will be for a limited disease, resected disease that are undergoing surgery, will be in a way, but will be completely different in patients that are diagnosed already with the metastatic disease, who are undergoing chemotherapy, and so there will be a different schedule of blood samples thereafter. So there will be a lot of information that will come from this study because the patients are very well characterized, also from a biological point of view for different histotype of the tumors. So there will be a number of sub-studies that will come out from this very, very large study that it is important to mention that is funded by the Italian Foundation for Cancer Research. The study is being designed as an Italian study. The institutions that are participating in the study are very important Italian cancer institutions, such as the Cancer Institute in Milan, the Humanitas Institute in Milan as well, some institutions in Rome, of course the Bergamo Hospital Oncology Unit. Another is in Bari, so in South Italy, so different places in the country, but very important oncological institutions. So it is designed, and as I said, is founded by the Italian Association for Cancer. The interesting thing is that we will have information in the first part of the study on the normal population. We have already the first data because, first of all, we have already samples from more than 8,000 normal subjects. And most of them have been drawn twice as in the project. And so the sample will be analyzed now and compared with the normal ones. But what we have is the follow-up, because follow-up is 5 years, so the first patients have already accomplished most of the follow-up. So we analyze the data of subject, because these are normal subjects, with a median follow-up of 3.2 years. And we were able to identify, these are subjects relatively young because are blood donors, so they go from 30 to 65 years. So, and we were able to identify 106 cancer cases that they developed during this follow-up, and these figures is very close to what can be expected in the Bergamo and the Milan area, in the same geographical area. We should have expected 118 cases, so what we have is very close to what can be expected in this type of a population. Then we have lots of information because these people are given a questionnaire on lifestyle, the drug intakes, number of physical activities. So we'll know from the oncological point of view, we will have an enormous number of information. So now, for now, we know that we are getting some cancers, and then we will see if some of our markers that will be measured in the samples drawn at enrollment are connected with the diagnosis of cancer. So this will be a very large study at the end that is epidemiological and also a laboratory study. So probably will give us the opportunity to understand whether the hypercoagulability can predict the diagnosis of cancer. And of course we can also have some other collaboration. We are starting collaboration with also colleagues from abroad, but for sub-studies that can be done on the pool of subject enrolled. Also for the oncological studies, all the centers are collaborating very well in Italy. We have a CRO that's following us, and is everything funded with the project, the research project. And the samples that are drawn everywhere are centralized in Bergamo. So we have established a biobank, very large biobank, and this is centralized in the Papa Giovanni Hospital in Bergamo. So there will be from now on also the possibility of other collaboration and other projects that can be submitted, also based on the first data that are coming out from this. Some data are very promising. We hope that some data can be published in the next months already, the first ones, and then we will see. I'm sure that for 2020, when next ICTIC will be, we'll have a lot more. That will be an important date for us because it's the 10th conference and the 20th anniversary of the starting of the conference because it's biennial, so it's the 10th and 20 years.